I think everyone started applying to colleges towards the end of junior year, and by the time it was senior year, everyone already knew where they were going, and I didn't, and I felt really nervous and scared and concerned that, again, I didn't have a plan. And so when I saw the email for the open house, again, I ignored it, but then I remember I went back and I thought, okay, well, let me just see what they have to say, or see what other options there are, for example, curriculum or programs of study. And my mom came with me the first time. By the end of it, we came in a little skeptical, but we left sure that COD was the place that I wanted to go to. Looking back in time would be to just keep an open mind, because I thought of community college as not a great option, as a second option to a four-year institution. My mom and I were able to tour around the building, and as soon as we saw the nursing facilities, we both just said, wow, like, did you see that? We were able to meet some of the professors that were going to be instructing, and seeing how much experience they had in the field. Some of them were still practicing. So I knew that I wanted to go into a health field. I just didn't know which one or which field was the best fit for me. And obviously I met with a counselor. We kind of talked about each path and what that would mean. I think the whole time I just felt comforted to know that I was working with people that knew what they were talking about, that had a lot of experience guiding other people that were also confused and not really sure of what was going on or what was the best choice. With living leadership, I remember I wanted to be more involved with COD. I think it was my first semester. I didn't attend any clubs or any extracurricular activities, and I didn't want to repeat the same story that I experienced in high school, where I really wasn't as involved as I would have liked to have been. I decided that I wanted my story to be different at COD. I wanted more out of my College of DuPage experience, and so I searched for it. Meeting new people, and so the Living Leadership program was my first step of stepping outside of the box that I created for myself. The nursing program is very rigorous, so it definitely prepared me academically to obviously handle more than what I thought I could handle. Just putting everything into practice, everything that we learned, and obviously the simulation lab made it even more real, where sometimes, and I was so surprised to see this too, that some of the equipment that we had in the simulation lab was even a little bit more advanced than some of the equipment in some of the facilities we went to. So it was nice to see that, oh wow, there's so much time, money, and resources invested into making sure that people are prepared once they enter into the real world. Originally, I actually wanted to do the 3+1 program with Benedictine University. I think they had the nursing program for that. Ultimately, I decided on NIU, mostly because, again, mentors. One of my mentors at NIU, Dennis Barcima, who also happens to be an alum of COD, I remember he came to tour the campus one day with his wife, Stacy, and I was one of the students that with the honor of greeting him and kind of showing him around. And I remember being so struck by who he is as a person, the things that he's accomplished, that I asked if I could just talk to him a little bit to have some guidance. I kind of told him what my plans were, and he asked me why I wasn't considering NIU, and I thought, well, I thought I had an answer, but I didn't. And so that's when I realized that, okay, wait, let me actually consider NIU. And after I looked at all my options, I decided that NIU was the next step for me. The great thing about it is that I was able to apply all my nursing skills into the public health program. So there were a couple of things, not a couple, there were a lot of things that I remember learning about and thinking, well, I already know this. I already learned this from my different nursing classes that I took. And so I was able to see tangible outcomes of how well I was prepared leaving College of DuPage and entering into NIU. with Peace Corps, I knew that I wanted to be part of the Peace Corps way back, even when I was going through the prerequisites for the nursing program. With that in mind, that's why I kind of started changing my trajectory from nursing to public health, because I thought it would be a good fit. But I chose Moldova specifically because I didn't want a Latin American country. I'm Colombian, and so I wanted to challenge myself where I didn't know the language, I didn't know the culture, I didn't really know anything. And the reason behind that is mostly coming from my time at College of DuPage and NIU, where I realized that I underwent so much growth when I was uncomfortable. I found this job as a health educator, and I knew that that's something that I wanted to continue, mostly because I did health education in Moldova, and I really liked my experience there. From the previous experiences that I've had, I've been in situations where I don't speak the language and you kind of just have to figure it out. And so those moments have definitely prepared me for the moments here at the clinic. The advice that I would give to incoming College of DuPage students is to keep an open mind, to not be afraid to try new experiences, because I think a lot of times it's in those experiences that we find ourselves or that we realize our potential.